Illnesses and disease. As we continue on with this concept, disease primarily is we want to focus on the prevention. There are three levels, and that one is primary, that is without disease. Secondary, disease is evident, but we're doing everything we can to keep it at that particular stage. And tertiary, where disease really does take over, disease or the illness takes over. And we want to either keep the patient free from it going any further or making sure that they have good quality of life. There are models of health and wellness, and these models can be found in your text, and I'd like you to refer to them, and as we're going to really discuss them later on in the term. But these models will assist nursing to meet health and wellness needs of the individual. Now we're going to look at what some of the international organizations think about health and who should have it. And according to the World Health Organization, they feel that health is for all is an international goal set by them, as a matter of fact, with their global priorities to increase life expectancy, to improve the quality of life, improve equity and health between and within countries, and to have ensure access to everyone. Thus, there's some key values that really are the main theme of this organization, and that is to have the highest attainable standards of health is a fundamental right. Strengthening applications of ethics, implementing equity, oriented policies and strategies, and incorporating a gender perspective to health policies and strategies. One of their methods to meet this goal is to have these vaccines. So vaccines preventable deaths is what their really goal is by 2015. That way they will protect more people, introduce new vaccines, integrate immunizations with other health interventions, and create global partnerships. In addition, they want to be able to aim the standards of health promoting policy making worldwide. In the United States, with the implication of 2010 that was published by the Department of Health and Human Services, were two broad goals: to increase the quality and years of healthy life and eliminate health disparities. Their major public concerns are to increase public activity, weight management, reduction in tobacco use and substance abuse, responsible sexual behavior, promotion of mental health, reduction of injury and violence, and improvement in environmental quality. So now we're going to look at some of the healthcare organizations that came about due to the change in our society. There are different types. They were for-profit organizations, non-profit organizations, governmental and non-governmental agencies. They consisted of hospitals, nursing homes, continuing care retirement communities, managed care organizations such as HMO and PPOs, home health agencies, and ambulatory care centers. Let's look at what those terms mean. Tax for not-for-profit organizations, that simply means that they're tax-exempt organizations and supported by taxes. Their mission is to provide service to the community and care to patients regardless of their ability to pay. Their focus was not on profit per se, as they want to make a profit to be able to improve their organization. Their funding was federal, state, or local government agencies. Their bottom line is covered by charging sometimes patients who can pay more to cover the cost of those who cannot pay. The outcome: in 1980, there was a major inflation, and their new technologies were on the horizon that increased healthcare cost. For-profit is another healthcare organization, and this area is a business owned by voluntary board of trustees. Their bottom line is to increase their profit share with their shareholders, provide care to paying clients, required to provide care to a percentage of charitable populations, however. They want to increase competition, and in 1980 there was a plethora of these national hospital chains that came about. Health plans, nursing homes, and dialysis centers, just to name a few. Some of these hospitals and not-for-profit are Jackson at Miami, Joseph Hospital in Tampa, Florida Hospital in Orlando, Tampa General in Tampa, Lakeland Regional in Lakeland, Memorial Healthcare System here in Broward, and Broward General. For profit, you have Cedars in Miami, West Florida, Pensacola, the Manatees Hospital in Bradenton, St. Mary's in West Palm Beach, Florida Medical Center in Fort Lauderdale, Kendall in Miami, and Adventura Medical Center.